Hi guys, welcome back again to Nursing and Therapy. My name is Adobe Okoye and I'm a nurse. And Nursing and Therapy is a channel where we talk about health, nursing, therapy, lifestyle, but anything that makes life good. Okay, so we discuss it here. So I have something very important to discuss with you guys, and it's on bedwetting. This topic came about because someone asked me a question on my social media hand. Actually here to share with you because I felt like okay, this is going to be a very good topic to let people know about it. A lot of people may be struggling with bedwetting as an adult. I'm not here to talk about bedwetting in children. I'm here to talk about bedwetting in adults. I mean, if you find it interesting, I know you'll find it interesting. All right. Okay. So here I'll be listing out I'll be giving you the outline. So I'll just talk about the overview, then the potential causes of bedwetting, um, then the management, like what I think you should do, um, like at home, or just something that lifestyle management, um, concerning this bedwetting. Okay, so I just wanted to know that I'm not here to prescribe any medications. A lot of people that come on to ask me, "Oh, can you prescribe something for me regarding this?" I don't prescribe. I'm not here to prescribe. I'm just going to. I mostly create awareness and then somehow give you tips on how to manage yourself. And if you have to see a doctor, depending on what you're presenting with and how you're presenting, then you see a doctor. Okay, so I'm not here to prescribe any medication for anyone. All right, let's talk about the general overview of bedwetting. It's important to know that as a child, like growing up in children, bedwetting is normal because at the time it's either their bladder is still developing and people don't have should I say control over when they want to have a wee, like when they want to urinate. So it just goes like they just let it happen just like that. But then as an adult, it's expected that everything should be all right, and then you as an adult should have like a control over your urine excretion. So then if you don't have the control over your urine excretion, that's where it becomes a problem and it looks like it's abnormal for an adult to be bedwetting. I know it's embarrassing if you are having something like this, but just know that there is no problem without a solution. So I'm here to just let you know and give you some tips on how to manage yourself, and then you find your way to the hospital if these things don't work for you. Okay, so now let's talk about the potential causes of bedwetting. I'm going to be dividing it into the medical causes and the lifestyle causes. Yeah, so under the medical causes, we have like hormonal causes. We have some, should I also say health causes like some cancer, you having diabetes, you having like kidney stones or bladder stones, you having urinary tract infections, and yeah, majorly this. So let's talk about the hormonal. Okay, then we have the lifestyle causes, which they are it's majorly about watching what you eat and when you eat or drink before you go to bed. So let's take it one after the other, talking about the medical causes. Now I'm going to try to make this video as short as I can, just to give you just briefly some information regarding this, but then you can go ahead and research as much as you want to ask questions, and you can even go far as asking your doctor if you have to. Yeah, so the medical causes, like the hormonal causes, so we have the hormones, like we have the antidiuretic hormones in the body that the body produces, and it helps to kind of control your urine production in the night. So as a person, if you have the issue where should I say you are low, your body is not producing enough, or your body is not just utilizing it, your body doesn't go well with the hormones, then you will have problems with, like, it predisposes you to bedwetting. So here I'm just trying to say that you may not know immediately that you've got problems with this, with the hormone. You may not just find out, but if you try this management strategies and then you still, like the ones I'm going to give you, and then you're still having problems with urinating, then the best thing is just to get to the hospital. Just know that it's not normal, so get to the hospital and speak with your doctor to carry out some checks, some tests, and then determine what the problem is, and then start helping you with the problems. Yeah. So I've talked about the hormones, the antidiuretic hormones. It helps to control your urine production, especially in the night. Most likely, most especially in the night. So it helps you to, should I say, decrease your urine production in the night, so that you'll be able to sleep well without having to, produce a lot of urine and then you keep waking up in the night to ease yourself. Yeah. So secondly, under medical causes again, um, I mentioned, okay, let me talk about the one that is very common, that's UTI, urinary tract infections. So when you have urinary tract infections, it predisposes you to urinating frequently. And the thing about UTI is that sometimes you don't even control your urine. And there's an inflammation around your urinary system, your bladder, that area. So it makes you urinate frequently. And sometimes you may just want to have a wee. So before you rush to the toilet, like you see that you've actually weed on yourself. So UTI predisposes people to having um, this problem with bedwetting. Um, it's something that a lot of people just take some antibiotics to treat when they have UTI, but it's always good, it's always better to get to the hospital, and some tests will be carried out on you, and then know the specific antibiotics to give you for this. All right, instead of just taking over the counter. Then I mentioned having cancer. Yeah, like prostate, because when you have like a growth to your urinary system, um it can block or prevent you, like you're not able to control your urine at times, so you don't even know when you're just passing this urine, therefore bedwetting, especially when you are asleep. Another important one is diabetes. When you've got diabetes and you're not managing yourself, you're not taking medications, and your blood sugar is very high, in the course of trying to excrete or remove the excess sugar, you tend to urinate very well. Like your body tends to push out the excess sugar through your urine. So what I'm trying to say here is that if you've got diabetes, you need to manage it well, because if you don't manage it well, it would predispose you to always urinating. Like, if you're not aware that you have got diabetes, and you try the management, the what I just mentioned about bedwetting, you try it. If you try it and it doesn't work for you, then you go for some checks at the hospital. So there are also some neurological factors or problems, like when you have Parkinson's, or when you have seizures. Here your brain sends, should I say, like a wrong signal at the wrong time. Something it's happening, so it sends a signal to your bladder, like to urinate, to open your bladder, to let your urine flow. So, well, these ones are already, they're like known causes when you've got them and you know that you've got them. So they are the ones that can predispose you to having them. So here your doctor can give you some medications to help you manage, like the ones I just mentioned. Your doctor can actually give you some medications to help you actually manage your diagnosis. Okay. And then when you've got like kidney stones or bladder stones as well, it's like an obstruction, So sometimes people pass urine and pass those stones, but then if you're not able to pass the stones, it also makes you like you don't even control your urine as well. Okay. So but these things can be managed. So I'm done with the medical cases. I know there are other medical cases, but I can't just list all of them, so this video won't be that long. So let's talk about the lifestyle now. The lifestyle being the time you eat and the time you drink and what you eat and also what you drink. So it's okay to drink water as much as you can in the morning and in the afternoon. And it's okay to drink carbonated drinks like fizzy drinks, stuff like that. It's not that healthy, but if you must drink them, it's better to drink them in the morning or afternoon and not to drink them in the night. Because this they trigger, should I say, they irritate your bladder and then it makes you want to ease yourself all the time. Okay. So and then especially at night. So if you eat a lot in the night, let's say you eat 50, 20 minutes before you go to bed, or um, just a few minutes before you go to bed, or you eat very late, let's just say you eat very late before you go to bed, it could predispose you, it could make you bedwet in the night, especially when you take these caffeinated drinks or like caffeine or carbonated drinks, like talking about cokes and Sprites and drinks like that, especially when you take them, it predisposes you to actually bedwetting. Now, I just want to give you some management tips, like how you're going to deal with bedwetting. Like, just try it out first, and if it doesn't work for you, you just go to the hospital for some checks. Okay. So the first thing is cutting down on these drinks, especially at night. So you can drink as much in the morning and the afternoon, but then when it's getting to your bedtime, please reduce the quantity or the amount of whatever you are drinking or whatever you are eating. So it helps you. What it does is that it helps you not bedwet, especially if you're already having the problems. And secondly, it also makes you sleep well. So even if you have to wake up in the night, you have to wake up like once, like let's say once, to just urinate and then you go back to sleep. Okay, because it's not easy to actually wake up in the night to urinate. So imagine they're already having the medical problems that I mentioned, like you are aware that you are having problems with bedwetting, urinating, and in the night, we call it nocturnal enuresis. So you are aware that you're already having that problems, and then you are eating a lot of this. Of course, what do you expect? You're making your problems worse in the night, like you're making it worse. You still find yourself, you're drinking and you're eating a lot of this, you still find yourself bedwetting. So the first thing to do is to cut down on any of this. Just try as much as possible to cut down on any of this so that you feel better, like you see that you're doing something for yourself. Then secondly, set an alarm if possible, like when you wake up in the night to ease yourself. It could be once or twice. Just set an alarm if you know that you find it very difficult to wake up in the night. I mean, a lot of us when we wake up to urinate in the night, we're trying as much as possible to stay asleep even when we are going to urinate, because you are enjoying the sleep so much, but you have to wake up to urinate, so you don't have to bedwet. So you're struggling to stay asleep while going to urinate. So, but if you know you're struggling to, like, if you know you're finding it very difficult, so you're bedwetting and you hardly wake up, set an alarm that would wake you up to just have a wee. Because just take for instance, while growing up, because I know that even mothers still do it till date. They around after their children go to bed, you see a lot of them, even fathers as well, they wake up and then wake their children up to have a wee. Just they wake them up to go to the toilet so they don't have to bedwet. And by the time they do it once, twice, three times, and even you as an adult, by the time you do it once, twice, like when you're consistent with it, you find out that at that time, even without your alarm, you just find yourself waking up to go and ease yourself. So you're already getting used to things like that. Okay. So I've mentioned two now. The third one, which is also important, is trying out Kegel exercise. Kegel exercise is an exercise that helps to tighten your pelvic region. So now the bladder, the vagina, the urethra, it's around the pelvic region. So so when you do this Kegel exercise, like when you practice it, it helps to tighten it. So imagine someone going to the, should I say, the older you get, the more your body loses its should I say tensity, like its tone. It's not that it loses its strength, sort of your muscles and the rest of it. So imagine old people. Now old people are known to, like the older people, they're known to have what do I call it? They're known to have frequent, like incontinence, like they are not continent enough, they're not able to help themselves before. That's why sometimes when you see old people, oh, they want to have a wee, they are running because they know that they're not able to hold it like when they were younger. But then Kegel exercise, it's something that you do that helps to strengthen or tighten your pelvic muscles. So I was giving an example. Imagine like when you're going to the gym, when you recently started going to the gym, because you want to build your muscles and stuff like that. And gradually you are beginning to tone your muscles. The first day may not be easy, may be painful, but then gradually you're getting there, you're beginning to tone your muscles, it feels tighter. So that's what Kegel exercise does for you. It helps your muscles, like you tone your pelvic region, your pelvic muscles, and then you're able to hold your urine, and then by not allowing it escape when you're not ready to expel, if you get what I mean. So Kegel exercise is very good, and also aside helping the bladder, it helps during sex. Research has explained that because the vagina is also around the pelvic region, when you do that, it helps with orgasm, it helps with blood flow through the vagina, and then it helps with um, orgasm. So generally Kegel exercise is good. So I can also add that while helping yourself, trying to do all this that I mentioned, there are also products that you can use if you are struggling with urinating, like bedwetting, and products like pad. Nowadays you have pads that even adults use, like diapers, something like that, that even adults use. It's okay. I know sometimes these things can be very embarrassing, but it's better you start now to actually deal with it or handle it than letting it just be there and damaging more, if you get what I mean. Like if you let things, sometimes people have this mentality that, oh, I'm young, I'm going to be all right, my body will revive, will regenerate and stuff like that. Yeah, it's okay. It's true that sometimes when things happen to you, that you're going to be all right. But then sometimes you don't take chances. You just have to go for it and then see if everything is okay. Like, and then, manage yourself. So if you try this that I've mentioned and it doesn't work for you, like try this methods I've mentioned, you can also research, ask your doctors about other methods. And I also know, I forgot to add as well, please, there's some medications that your doctors would give you or could give you depending on your diagnosis, which can cause you to produce more urine, like it causes you to urinate more. I'm sure that if a doctor is giving you that medication, the doctor is advising you, like telling you about this medication and what it does, and if there is like an alternative or a substitute for that medication, the doctor would give you a substitute. But if there is no substitute for it and you really need that medication, the doctor would give it to you, but then give you measures or lifestyle on how you manage with urinating. Okay, so in addition to the medical causes, some medications can also cause it. So I'm just going to list it again for you to um like remember. If you've got diabetes, cancer, hormonal problems, medications, some neurological problems like seizures or like epilepsy or Parkinson's, bladder stones, kidney stones, urinary tract infections, these are the things that can make you to bed wet. And knowingly or unknowingly, when I mean knowing, like if you don't have these problems, any of it. But then if you don't know about this and you are bedwetting, so you can try the my measures, what I just said to you now. But then even if you try it and it doesn't work, please go to your doctor. go to your doctor to check you out and see if there's anything that you need to help you with this with this problem. All right, so I've come to the end of this video and I hope I made it short. Well, as always, you can ask your questions. My email address is down there, zenithhealth@gmail.com. My Facebook handle is Adobe Okoye. Instagram is Adobe Okoye. So if there's something you need us to discuss about, or there's something that is troubling you, you can ask questions and then I'll always help you with it. So I hope you enjoyed this. Please share with your friends, listen, share with your friends, and don't forget to subscribe. And I hope I'm going to come back soon. So, like I said in the beginning, this is nursing and therapy. We're here to discuss about health, nursing, therapy, anything that makes you feel good, like balance in life. Okay, so I've come to the end of it. And take care, and I wish you all have a very lovely day. Bye, guys.